Noise చేయకండి 30 minutes దాకా. Okay? Already we have started these drugs. Okay? So we'll start with the next. చెప్పు స్టార్ట్ అయిందా లేదా?
స్టార్టింగ్
మీరు అడగండి వస్తున్నానండి. ఓకేనా? Whenever you are coming to college, you go from like this. Don't go from here. చెప్పు రమేష్. Schedule down fast. అవుతుందా?
Yes sir.
Okay, good morning one and all. Today we are going to discuss anti-cancer drug. Okay. So according to you, what do you mean by cancer? What is cancer? What is the study of cancer called as? Oncology. Okay. So what is the characteristic feature of a particular cancer cell? What is the characteristic feature of a cancer cell? Yes. Anyone? It shows uncontrolled division and metastatic nature. What is metastatic? It is not confined to one location and it will be mobile. Means it can move from one tissue to other tissue and where it has ability to form a tumor. What is a tumor? A lump or mass of the cells is called as tumor. Okay? And why that lump or mass of cells are formed? What is the reason? What is the reason for the formation of cancer growth or tumor growth? What do you think? Yes, anyone? Why? Reason ending? So management of cancer will be of 3 types. As we have already discussed the cancer, what are the different characteristics, what are the metastatic nature. Now coming to management, we will be having 3 types of management. One is radiotherapy, one is surgery and chemotherapy. Okay? And all of you know what is surgery, what we are doing in the surgery. The part which is having tumorous growth, to prevent the further growth or further spread of the cancer, we are removing the healthy tissue or what we can say healthy tissue or which tissue we are going to remove. That to prevent the progression or to prevent the further spread of the disease, we are going to excise the bad tissue or cancerous tissue, not healthy tissue. Okay? In surgery, we are excising the complete part of the tissue. Okay? And coming to chemotherapy, as we already know, we are using certain kinds of drugs or certain categories of drugs which are targeting the particular cancer. It may be hormonal or indirect cause. Clear? Now coming to classification, what do you mean by remission? What is remission? Actually, according to you, what do you mean by remission? Anyone? Remission అంటే ఏంటి? What is allergic reaction remission? What is eczema remission? Means causing of symptoms. Remission అంటే again the symptoms will start due to some stimulating factor, that is called cure or prolonged remission. Means under management of cancer we will be having different kinds of drugs. This comes under chemotherapy. Chemotherapy, no? Cure or prolonged remission, palliation, adjuvant chemotherapy. Okay? Under this the important one is the chemotherapy. Clear? Now coming to classification of anti-cancer drugs. First category is the alkylating agents. What do you mean by alkylating agents? Any alkylating and agent? What do you mean by alkylation? What do you mean by particular alkylating reagent or agent? Yes? These things will, when we are taking these kind of drugs, they will create some form of free radicals. Okay? They form free radicals which are highly reactive. Okay? Which are highly reactive. These reactive agents will damage the DNA which causes replication. Okay? Understand? All of you understand? These agents will cause damage by producing free radicals. Okay? So when these free radicals are produced, what happens? They cause damage and then preventing the replication of the DNA. So form into tumors. Okay? That is the drugs of, and that is the reason they are called as cytotoxic drugs. What do you mean by cytotoxic? Cytotoxic anyone? What is cytotoxic? What is cytotoxic? Then they are toxic to humans. Suppose if you are taking poison that is toxic to humans. In similar manner, these drugs are toxic to particular cancer cells. That's what they are called as or referred as cytotoxic. they involve in damaging of the cancerous cell, not healthy cell, cancerous cell. Okay? So under this category, the heading will be cytotoxic drugs. Under cytotoxic, these are the different examples. Okay, first is alkyl agents. Under alkyl agents, these are the drugs which are going to use, that is metoclopramide, cyclophosphamide, isofamide, chlorambucil and melphalan. Okay, these are alkyl agents. Next, antimetabolites. What is antimetabolites? Close the door. Ask them to wait. So pause it. So first category of drugs, first are the cytotoxic drugs. Okay. Cytotoxic drugs. Second drugs are antimetabolites. Example: methotrexate, 6-mercaptopurine, thiopurine, azathiopurine, 5-fluorouracil, cytarabine. Now, if you go through these names, there are similar compounds which will be having the same name or same pronunciation. Can you guess the drugs? Yes, sir? Do you know the same drugs which having same pronunciation? What are they? Anyone else? Same pronunciation. What are the structures of DNA? What are the nucleotides in DNA? Name them. Cytosine. Cytosine is there, right? Next. In the cytosine. Is there or not? Next. Guanine. Guanine is there? No. What is there here? Methotrexate here. Here. Antimetabolites. Methotrexate. 6-mercaptopurine. What is this? What is the purines from the DNA? Purines pyrimidines. Okay. 6-mercaptopurines. Next, thiopurine. Guanine from the one of the adenine guanine. Do you remember? Okay. So cytosine, guanine, uracil, ribose sugar. In RNA it will present uracil. Okay. And cytarabine. Okay. So these are the antimetabolites which mimic the actions of purines and pyrimidines, but they are analogous, but their function is not as that of these purines and pyrimidines. Okay. So they get incorporated into the DNA strands in the place of these purines and pyrimidines. Okay. So when normal purines and pyrimids are integrating the DNA, normal DNA structure and replication will be seen. When these compounds are integrated, the metabolism means the formation of DNA strand won't happen. Okay. If proper DNA strand is not happening, replication won't happen. When replication is stopped, growth of cancerous cells will be inhibited. Clear? That is why they are called as anti-metabolites. They are interfering with the metabolism or normal metabolism of the cells. Clear? Anti-metabolites. So these are the anti-metabolites. Next are Vinca alkaloids. Have you seen Vinca alkaloids? Vinca plant. What is the name? Botanical name? Echinacea roses. Okay. So these are the Vinca alkaloids which are obtained from the plants. Okay. And one is vincristin, vinblastin, and next one are taxanes. These are also plant compounds which mimic the same action as that of Vinca alkaloids. Okay. How does the act is made? We have discussed in the previous one topic. I hope you also remember. Okay. So these drugs are also active by preventing spindle formation. Okay. Vinca and vincristin and vinblastin prevents the formation of spindle fibers. Okay. From where spindle fibers are formed? Microtubules. Okay. So they inhibit the formation of microtubules as spindle fibers are not formed. If spindle fibers are not formed, what will happen? No cell division. No, the cell is not distributed into half or not divided into half. It is not dividing. Growth is not. Here, mitotic, in the mitotic phase it will come mitotic division. Okay. So they act by preventing growth శాతం of the cancers are by stimulated by cancers. Anyone? Cancers ఏవి? చెప్పండి. No answer. Why you are hesitating? Prostate cancer, hormone cancer, breast cancer, uterus cancer, all these for these the stimulating factor is the which one? Estrogen. Okay, so these are the agents or drugs which act by inhibiting the hormone mechanism. Okay, one is glucocorticoid, prednisone, and estrogen. Estrogen is nothing but which is related to treatment of uterus cancer or uterus cancer or breast cancer. Why? Because they continuously stimulate the estrogen receptors. Okay, and coming to prostate, estrogen is the stimulating factor to progress that cancer. Okay, now these are the third category of drugs. These are directly inhibiting the hormones, and these next two drugs they are selective estrogen receptor modulator. What is the modulation? Modulation and what is modulation? What is modulation? Modulation meaning ఏంటి? To change the way it works. Okay, so beta 1 blocker is there. What is the antagonist of beta 1 blocker? Sorry, beta 1 receptor blocker indi. What is the blocker of beta 1 receptor compared to adrenergic receptors? Adrenergic are super there. The blocker indi. Example, give me the example of beta 1 blocker. Beta 1 blocker example. Beta 1, I am asking me not also beta 1. Propranolol, sotalol, metoprolol. Beta 1 means you have to say metoprolol because it is specific to beta 1 only. Propranolol is non-selective. Non-selective means it will act on all the beta receptors. Beta 1, beta 2, beta 3. Okay, that is why it is also used as anti-anti. Okay, so that is the selective estrogen receptor modulator. They are modulating the estrogen receptors. How estrogen related cancer will progress? Any particular idea? But estrogen తో మనకి క్యాన్సర్ వస్తుంది. Okay, how it is progressing? What is suppose prostate cancer is there? Saying the symptoms are pronounced. How it is progressing? What do you mean by that? How can we halt that progression? Yes. So testosterone hormone is the main driving factor for progression or causative factor for testosterone. This one, prostate cancer. Coming to females, estrogen driving factor means estrogen will continuously stimulate, okay, the cancer progression. What if we are blocking the progression or stimulating factor? How can we block? Suppose estrogen cancer undi, a stimulation మనం ఎలా బ్లాక్ చేస్తాం? Can anyone tell me the proper answer? Suppose we are taking hypertension, we said beta 1 blocker. What is the need to take that beta 1 blocker? To for what we are doing? For what purpose we are using beta 1 blocker? Beta 1 blocker ఎందుకు వాడుతున్నాం? Loudly. Anyone? Why we are using Sangeeta? Beta 1 blocker. Right? To treat hypertension, we are using beta 1 blocker. In similar manner, to prevent cancer progression of particular hormone, estrogen receptor antagonist. Here they said modulator but antagonist demand. Okay? Estrogen receptor antagonist, estrogen receptor antagonist. Okay? So these drugs prevent the stimulation of estrogen receptors. When estrogen receptors are inhibited, cancer progression will stop because stimulating factor estrogen is not binding onto the estrogenic receptor. Understood? Okay? What do you mean that is aromatic enzyme? Aromatic enzyme is not you have heard the name before. What is testosterone? You have heard. How testosterone can convert into dihydrotestosterone? Yes. Testosterone is converted to dihydrotestosterone. What is the process? Yes. Tell me the hormone name. What is the hormone name? Okay, testosterone convert to dihydrotestosterone or other secondary metabolites. Which hormone? Aromatase enzyme is nothing but it is involved in conversion of estrogen to its secondary metabolite. We can see inactivation. Okay. So this aromatase enzyme prevents inhibitors. Prevents this aromatase enzyme. Okay. Inhibitor like all of you know inhibitor right stop. Okay. Aromatase enzyme is an enzyme which converts estrogen to some other secondary metabolites. Right. So this aromatase enzyme it is inhibited. It prevents the conversion into estrogen. Okay. Clear? Correct or wrong? Wrong. Why? Who will get what is aromatase enzyme? You tell me now. Last benches. If I say wrong, you should correct me. తొందరగా వెరీ ఫాస్ట్ మా రాంగ్ వాట్ ఆన్సర్ వాట్ ఆన్సర్ estrogen to secondary metabolites other video this estrogen pharmacology 1 lo okay when you bring this luteinizing hormone follicle stimulating this one. Do you remember this name? Male hormones, female and other. We have gone through all those topics, right? Okay, aromatase is an enzyme which helps in production of estrogen. Okay, both males and females. Okay, that is why I asked testosterone how it is converted to different. Males whether estrogen is female or not. Males suppose estrogen is a female hormone, right? All of you know, right? This one, estrogen is a female hormone, but whether it is seen in males or not, it is present in males or not. Why? Is there any use of estrogen in males? No use, but it has some main function or some function in males. All the males will help in protection of joints. Okay, that is the reason after menopause in females, after 50-55 years they suffer from joint pain because estrogen levels will drop. Right? This is the reason because estrogen also helps in males by preventing the joint pains. Okay, or joint disorders. That is the main function of estrogen in males. But predominant levels will be testosterone, but small levels of estrogen will be there in males also. Okay, so that estrogen conversion will be done by this aromatase enzyme into estrogen. Okay, clear? So these are the aromatase enzyme inhibitors which prevent these conversions. Clear? So convert this enzyme inhibitor example into these letrozole, anastrozole, and this is the third generation drug which is more potent without side effects. Okay, suppose when this drug is used, will be more joint pains because we are preventing the estrogen from forming. Okay, so there is no protection of these in the males. So severe joint pain will be seen. Coming to exhibition that it is non-steroidal agent and it is more than letrozole. So these are the estrogen that is anti-estrogens. Now, anti-androgens. Why there is a need to take anti-androgens? Anti-androgens is reduced. Why they are using anti-androgens? This therapy was used. What is getting anti-androgens? Anti-androgens are males. Okay, and we need to take anti-androgen drugs males to prevent baldness, and to prevent prostate-related cancer, which is driven by testosterone hormone. Okay, that is the reason we are taking this anti-androgen drug towards a particular treatment, that is alopecia or cancer related to prostate. That is commonly used in the flutamide. Alopecia is commonly used. Okay, they prevent cancer into DHT. What is DHT? Which is more potent, androgen or DHT? Testosterone or DHT? DHT is more potent, more stronger than. This is the reason. With the help of this DHT only we will get this balance or alopecia. Okay, so this is an example of anti-androgen. The next one is 5-alpha reductase inhibitors. What is 5-alpha reductase? 5-alpha reductase is nothing but which convert testosterone to DHT. Okay, these are the conversion process. Also be used in treating alopecia balance. Next, GnRH. What is GnRH? Okay, these drugs both belong to gonadotropin. Means they mimic structure same that hormones, but they lack the functions to stimulate the release of the gonadotropins. What are gonadotropins? Estrogen, testosterone. Okay, prostate cancer also that is due to testosterone. Okay, so to prevent the testosterone, we need to use this gonadotropin releasing hormone, which are similar to this naturally producing hormone, but they lack the ability to stimulate the pituitary gland to produce these hormones. When these hormones are low or inhibited, testosterone can't able to be released or synthesized. In similar manner, estrogen also. But in both male and female, they are called as gonadotropin releasing hormones. Another also they mimic the same structure, but they lack the potential to help in release of this particular hormones. Here, gonadotropins, thyrotropins, these are the stimulating hormones which are produced in the pituitary gland. First account is the stimulating factors. Then secondary gonads. Suppose gonads are the secondary organs to produce hormones, but for them to stimulate we require gonadotropin releasing hormones. Clear man? Understood now? Next one. Next is toxicity, general toxicity of cytotoxic drugs or water cancer drug. You take all drugs will be having bone marrow suppression. Okay. Bone marrow suppression is what will happen in the previous topic also I have told. What process will get inhibited? Yes. Suppose bone marrow is suppressed. What are the effects you can see? Symptoms of bone marrow suppression. Anemia and sickle anemia. What are the physical symptoms we can see in a patient? Physical symptoms, what we see in a patient of anemia. Yes. Pain. Color will not happen. Early symptoms I am asking. Breathlessness, anxiety, lethargy. First we should give these signs first. Later when the symptoms are more pronounced, we can tell later. The discoloration of skin. All will be seen at the later stages. Okay. So general toxicity of this side of the example first one is bone marrow depression. What will happen in bone marrow depression we have seen. Okay. Next one, lymphoreticular tissue, lymphocytopenia. What is lymphocytopenia? Penia means death. Right? Cyto means cells. Cells providing immunity. That is why lymphocytopenia. Okay, lymph contains WBCs only. Lymphocytopenia means the death of the WBCs or lymphocytes. Yeah, and inhibition of lymphocyte function. What is the function of lymphocytes? Lymphocytes. Immunity. Lymphocytes. And B. What is the function of B? Antibodies, not antibodies. Antibodies. B cells helps in production of antibodies for a particular antigen. What is the function of helper cell? B cells. Memory cells as well as helps in de-differentiation. De-differentiation means cells will get separated into other forms. That is called de-differentiation of lymphocytes. Okay. Next one is oral cavity. That is the reason for oral occurring cancer, the tumor growth will be at a high rate. Confusion of oral cancer to take products, the tumor size will be more. That is the reason. Anything, if an injury is happening in the oral mucosa, you can see the healing will be in a rapid state. Suppose we are mouth ulcers or in aerosol where you can see rapid healing in the mouth, right? That is called rapid turnover. Because of that property only, the healing in the oral tissue will be much faster than the other areas. What is the reason for that? What is the reason for that? Why anything injury or something happens in the oral tissue will be healing faster than other tissue? What some emergency drugs also kept under tongue, if you remember. Why? What is the particular reason? High vascularity. High vascularity will be there. Because of the reason, the healing will happen faster rate as well as the drugs will be absorbed at a faster rate. That is the reason we are using oral route for the emergency condition like heart failure or myocardial infarction. Okay? The next one. Under GI adverse effects, all of you know. Diarrhea, shedding of mucosa means irritation, gastric irritation. Okay? Hemorrhages. All the hemorrhage, how it happens? What is the reason for hemorrhages? Everything is interconnected. Hemorrhage goes to GI tract. Ulcer, on GI irritation of the GI, nothing but irritation. All will be in a scientific name. You try to understand. Okay? Shedding of means nothing. GI irritation. GI irritation leads to development of ulcers. Ulcers causes hemorrhage in the GI tract, bleeding. Clear? Next one, drugs that affect frequently cause mucositis and inflammation of mucosa. Right? Inflammation of the mucosa. In the mucosa, what is present in the mucosa of GI tract? Anyone? That cells are present inside. What are the cells which are called which produce mucus? Mucus producing cells are called as what? Anatomy. The cells which produce mucus are called as what? Goblet cells. Goblet cells. Have you heard the name goblet cells? Goblet cells. Goblet cells produce mucus. Okay? Here, what are the four cells are present in the stomach? Only stomach, not GIT lining. Only stomach. The cells which are present in the stomach lining, not GIT. Parietal cells. Four cells. What are they? Next continue. And all of them is called nausea and vomiting. Okay, you game rakuna, you write this one. Nausea, vomiting. Clear? Inhibition of gonadal cells causes oligospermia, the sperm levels will be reduced, and importance in the males. And fetus, particularly all cytotrophs, are given to profoundly damage the development of fetus. chains. Okay, how they will act? How alternating chains will act? By producing what? Free radicals. These free radicals will bind to the DNA, LDMA and damage it. Okay, so that kind of drugs are all safe in pregnant women. Okay, here is technically administered to pregnant women. Next, hyperuricemia. What is hyperuricemia? Uric acid, not urea. Okay, hyperuricemia. By we can say hyperuricemia cancer chemotherapy patient. Why? Because we are using purine analogs, anti-metabolites, 6-mercaptopurines, and these uric acid is produced from what is the site or substance which produces more uric acid. Then nunchi uric acid form avutadi. What is the substance called as? Doctors don't have doubt. Doctors will advise don't have purine rich diet. Purine rich diet. High sugar and what else? All non-veg will be category of high purine diet. Okay, so here massive cell turnover. Cell destruction outunte will get uric acid production. Okay, because purines are released. Purines are metabolized into uric acid. So in cancer chemotherapy patients there will be high levels of uric acid in the blood. Clear? That is why hyperuricemia. Then adverse effects in the chemotherapy patient. Clear? Alkaline and related compounds on the to make a different function. I have already told you. Alkaline how they act? They damage the DNA. Act by forming these free radicals which are produced, they bond covalent with the DNA and impeding DNA replication. The free radical which is produced when alkali is taken, they bind with the DNA. Okay, and prevent the replication process. Here, next one is antimetabolites. Antimetabolites are told to they block the pathway in the DNA synthesis like methotrexate, 5-4-acid, okay, cytarabine. They are analogs to purines, so they interfere with the DNA functioning. When DNA function is interfered, DNA synthesis process will be compromised, and the cancer progression or tumor formation will be inhibited. Clear? And bleomycin, dactynomycin, these are different drugs which mimic the actions of damaging DNA. These are each drug, how they are acting. For example, study about it. Alkylating example, cyclophosphate if you are studying, that is more than enough. Okay? Study. In the next class, I will start with the different